We're waiting to go live, right?
And we are live now.
Welcome, everyone. Thank you to everyone who is here today. We're going to wait 5 minutes before we begin the class. In the meantime, I do want to thank our sponsor, High Profile Bodega, a cannabis company opening 3 retail stores in the city of Boston, and our panel of experts that have worked with me to create this class. So we'll give you guys about 4 minutes to enter the room, and then we can begin.
There we go.
Hi, Dad.
All right.
Yeah.
Hello, everybody. Can you hear us okay, Vanessa?
Great. All right. So thank you all for being here. My name is Desiree Franjul. I am the Community Outreach Director for High Profile Bodega and CEO of Herbal Power. Over the past 10 years, I've really focused my time and energy on community activism and wellness. And that, along with my recent experiences in cannabis, have really inspired me to create an educational series that will provide people with the information they're seeking. So when I started making edibles in 2016, I learned a lot of people wanted to try cannabis without smoking it, mostly for pain or anxiety or sleep, but they didn't really know much about it. So when I met Erin, Glorya, and Dr. McNabb, who are already doing research on cannabis for pain, I knew that we can all work together to bring cannabis education to our community. So again, I thank everyone who's here, and I'm really honored to be able to share this information with you. I will hand the floor over to Glorya Fernandex.
Well, actually, this is Norma Blow. I am the alter ego of Glorya Fernandex, and I am Canna curious. I've been Canna curious from a very young age, and most recently, in the last 2 years, I got into the culinary arts and became an instructor. And during that time, I really met a young lady who I really liked a lot, and she wasn't well, and she was getting dialysis, and she was uncomfortable. I had a friend that grew. I took trim and started making vegan edibles because I figured the cleaner and clearer the food was passing through her body would assist her in pain relief. And then another friend had a husband who was recovering from prostate surgery. Then I had another friend who had anxiety, and it became an exploration. My focus with Go-Go Bites is using clean herbs and spices to heal, to motivate us into a cleaner way of living. And this is exciting. And Desiree, thank you for putting this together and putting us together. And to the left, Miss Erin.
Hi, my name is Erin. I've been a nurse for over 20 years, practicing in both Massachusetts and Rhode Island. Prior to cannabis, my experience is in the hospital, doing just regular med surge. Also, I did pediatrics, doing newborn home visits, and then to the opposite end of the spectrum, doing palliative care, end of life, hospice care. And over the spectrum of my career as a nurse, I would say maybe 10 years ago, I decided to go and become a caregiver and get my patient card. And I started cultivating. And since then, I have gone to school. I went to the Medical Cannabis Institute and did the curriculum for nurses, and I got my master's certificate. I've had the pleasure of working for Edibles Magazine, the Emerald Women's Lifestyle Cannabis Magazine. I've had the pleasure of working here with Dr. McNabb for the Cannabis Center of Excellence. And I have had the pleasure of helping many patients cross the barrier of using prescription medication and into the world of holistic plant medication.
Awesome. Yeah, thank you so much for being here, ladies.
Thank you.
Yeah, really appreciate this. And thank you to Desiree so much for organizing and supporting this educational event series. So my name is Dr. Marion McNabb. I'm the president of Cannabis Center of Excellence. We're a 501c3 nonprofit organization based out of East Boston. We're actually in our East Boston office. So really thank you all so much for being here as part of this Zoom educational event. So this is a 3-part series that that High Profile Bodega has sponsored, and we really appreciate the support to make these 3 events possible. So what are we going to do in these 3 events? What we're going to do is we have first two events will be virtual events like now, where we'll present a little bit of information, not too much. We don't want to make it. We want to provide you with some valuable slides and information, but that you can go access later. And the majority of the time, we want to actually sit and answer any questions and interact with you all. So if you have any questions throughout the time that I'm going to be presenting really quick, please put them in the chat. And then what we'll do is we'll turn over to a moderated discussion by a beautiful moderator, Glorya, and hear from Erin and her expertise, and myself and Desi may also be able to pop in. So feel free to start writing down your questions as we go through this information. If we don't have an answer to your questions that we can't provide to you tonight, we'll do some research and get back to you. And we've set up a space, a learning management system site for these three events. So you can go and access, we'll provide links where you can go and register for that after this event, and then access some of the free resources that we are talking about tonight. So we're going to get into it. Now, this presentation is designed for those that are canna curious. This is a Cannabis 101 presentation. So if you work in the industry, if you're an expert, if you're a business owner, this might be pretty intro level for you. I think our goal is to understand that there are many consumers and patients out there and people out there that are just curious. I just want to know about cannabis and want to know about what's out there, how they can get it. So in our talk today, we're going to cover some of that. What is the basics around cannabis? What are the different types of cannabis? What's the history of prohibition around cannabis first, to understand and lay the land? And then we'll go into talking more about some methods of consumption, give some tips and tricks, and then hand it off for a discussion. So next slide, please. So we're just going to start super simple here. Cannabis is a plant, and it's a plant that's been used for over 6,000 years as a medicine or as an agricultural product or for personal consumption. And so while this long, rich history, we can see across the world and in many cultures, everywhere from India to Africa to Latin America and North America, all major cultures have a history and either using cannabis as a medicine or for personal use around the world. Now, we know that cannabis has been used around the world, as I just said, for thousands of years. However, in the United States, there has been a prohibition related to cannabis. Now, the prohibition related to cannabis started as a result of, I think, a couple of factors, some of which were a reefer madness campaign that was designed to racially driven to make people that were people of color or Hispanic demonize them and in very racist terms, as you can see the reefer madness posters that are on the slide here. And that all of these multiple forces led to what resulted in the 1937 Marijuana Tax Act. Next slide, please. This act was passed in 1937 and was drafted by Harry Anslinger and colleagues. And this was the foundation of a raging war on drugs that continued in the United States and a war against people of color and those that were involved with cannabis. Now, right after this act passed, next slide, please. Cannabis, which was traditionally included in the US pharmacopoeia, where physicians were using and could prescribe and dose cannabis to patients, it was systematically removed from the US pharmacopoeia in 1942. Now, when that happened, several other acts happened later, the Boggs and the Narcotic Control Acts, and then the Controlled Substances Act of 1970 placed cannabis in the Schedule I illegal substance category at the federal level. Now, over those decades that I just spoke about was a raging war on drugs. Sadly, that was against people of color, and still, despite the legalization and the raising of awareness and the access is increasing to cannabis now these days, disproportionate arrests and targeting communities of color with cannabis is still a reality. This is a report that was just published. Oh, back slide, please. This report was just recently published that talks about the racial discrimination and the history around cannabis. And it's extremely important for us to understand this, even just as consumers and patients, for a number of reasons. One, social equity and economic justice related to cannabis is of great most importance here in the Commonwealth. Desiree herself has attended the social equity training and is a social equity participant. And so really grateful to continue to partner and support programs that encourage social justice and social equity. So next slide, please. So now let's get into, well, it's legal here now in cannabis. We have had this prohibition. It is legal in Massachusetts, and it's legal for both medical use and for adult use. And it's a great opportunity for us to continue to learn and educate and understand what these new products are out there on the market and how do they impact us. So next slide, please. So what we want to cover really quickly, and then you can ask questions, is how can we safely and effectively consume cannabis? What are all these new terms? How is it consumed in new ways? And then how does the plant really work within our bodies? Next slide. So medical cannabis, you can become a medical cannabis patient if you can register and get a medical card in the Commonwealth. If you're identified as having a health condition or a symptom, you can access a healthcare provider and then get a state registered card. You're also legally able to access cannabis through personal use through a retail dispensary, such as the ones that our sponsor for tonight's event are planning to open in Boston. Those are adult use. These are two separate types of establishments, and they have separate requirements. Next slide, please.
Also known as recreational use.
Also
Adult,
known as recreational use. And
they're
very true. When we come to the names, that's a very good point. There are certain reasons and rationales for saying things like cannabis or adult use and recreational use. And it's important to understand what the inferences of those terms mean. When we think about what is cannabis and how does it interact with the body, we have what's called an endocannabinoid system. And this system is not taught currently systematically in our medical schools or any other of our education as a result of it being removed out of the pharmacopoeia and the history that I just explained. The endocannabinoid system has receptors on the cells and the nerves in the bodies and almost every system in the body, and it facilitates two-way communication. It's essential for our balance, maintaining our balance, and for recovery and repair. Next slide, please. So these are some of the reasons and the health conditions that qualify medical patients in Massachusetts to get a medical cannabis card. And it's the benefits of getting a medical cannabis card include you don't pay state taxes, you can get access to discounts, and you can have higher purchase limits, and you can also have registered caregivers on your behalf. Next slide, please. So this one's very interesting, and I'm just going to cover it quickly, and you'll be able to download this, and we'll be able to talk all about all of these things in just a few minutes. But what is the really important thing about this slide is that cannabis, this is back to the terminology, marijuana and hemp, and what is cannabis? Now, marijuana is not a scientific term. It's a slang term that was created, and it was prohibited and pushed through prohibition. Hemp is not necessarily a scientific term either. Hemp is a regulatory term that is applied to define industrial produced cannabis or that produce low levels of THC. Now, when we look at both are the same plant, both are cannabis, but why do we have a hemp regulated industry under agriculture here and a cannabis industry? You have to understand the little nuances around that. Mm-hmm. Now, the same plant produces cannabinoids. Hemp plant produces cannabinoids, cannabis produces cannabinoids, and it also produces terpenes. Those are important pieces in our section. So now when we go into really understanding cannabinoids, CBD versus THC, here's a few differences. We'll talk about that more in the Q&A. because I know that these ladies will have a lot of ideas on talking about these differences. Next slide, please. So now, just to briefly cover, there's a different couple ways that cannabis is consumed. Next slide. Well, we'll just break it down for now in this very simple 101 into 4 main areas. And I think I want to add suppositories too. But the first one is inhalation. Second is ingestion through the mouth. The third being sublingual, so under the tongue. And the fourth being topical on the skin. So you can smoke it, you can eat it, you can tincture it in your mouth, sublingual, and you can topical it. Now there's a suppository route as well that's not listed on the slide. The key things are that the onset time of when you take some of these different forms of cannabis is different. If you smoke, it's going to come on quick. If you eat an edible, it's going to take a little longer. Here's a great slide that talks about that specifically. So on the first on the left, this is inhaled cannabis. The onset time for when you're going to get those effects are very quickly. However, if you're ingesting cannabis in an edible format in the middle, those effects that will take a little bit longer time for it to actually hit you, and it processes in your body very differently. And so the onset time, it's going to be not immediate necessarily when you're eating an edible. It'll take a little bit longer and durate a little longer and have different interactions in your body. But if you take it sublingually, it'll work much quicker, as you can see on the graph, and last longer. The reason why we're bringing up these different points is that they're different for different reasons and rationales. So I'm a medical cannabis patient. There's certain times that I have a tincture when I need breakthrough action and something to happen quickly. But if this afternoon, thinking about a drink to calm and keep my homeostasis, but maybe sometimes I might want to smoke for a different purpose. So it's important to understand what they do to the body and how it interacts. Next slide, please. And we will again have all these slides available for download, because I know there's a lot of information on there, but hopefully helpful information. So just again, smoking or inhaling cannabis, you can either smoke or you can vaporize your flower. These are some terms that you can ask us questions about. But historically, it's the most common method is smoking. Next slide, please. The second most interesting and common form of consuming cannabis is actually eating cannabis. So one of the things that we like to talk about is the importance of microdosing when you're eating cannabis. New users really just need to start low and go slow. You can see on the bottom here, 2.5 to 10 milligrams, and then you titrate up over time. It's extremely important when you're eating cannabis to start low and go slow. And if you are experienced, you'll see, intermediate users will need more milligrams, and frequent users, such as myself, typically will have higher milligram limits. Next slide. Another common way that people can consume cannabis now is through tincture format. So you can get alcohol-based, oil-based, glycerin-based, and I'd like to hear others that have other ideas on the line or in the room. But it's one of the biggest benefits of using tinctures is your dosage control and that fast acting as well. And you can always get the right amount of medicine and be able to get the right mix of what you're looking for. So I think one of the most important, thanks for bearing with us on some of these technology issues, but one of the most important things to remember also in extracts and tinctures is that you can start to combine these terpenes and cannabinoids and the THCs and the CBDs that we were talking about. And there you can get to personalized medicine. Next slide. Topicals are just balms, creams, lotions, salves, oils, sprays. Things that you can, put on your body that will have an impact apart from smoking herb, which is typically the most common form. Topical cannabis has been one of the most common ways that people have consumed. Now, this is the new area where at least I feel like it's still new to me, is cannabis concentrates. There's all different types. There's shatter, there's wax, there's BHO, there's distillate. I'm not going to go into them. I just want you to know. We will talk about it when we get in here, but next slide, please. The thing to note about cannabis concentrates is that you can vaporize them in different ways, but they are much highly concentrated than smoking flower, some of the other forms. So very strong. Now, this I put up here because this is a great, if you ever want to learn about cannabis, I really like periodic edibles. They do a lot of good work on their education side, and they have this really great bud tender edibles. What should you ask your bud tender in terms of edibles? And so I will put it in the resources. It's a 5-page document that I think is really cool and based on some really innovative points. But the one point I want to pull out here is the entourage effect. So the entourage effect, and just so that we can understand it, is a key term to understand the unique effects that you experience when you consume the whole cannabis plant versus a THC distillate, a CBD distillate, or another type of distillate. The cannabis plant, I mentioned the endocannabinoid system. The cannabis plant has cannabinoids and terpenes that interact with our endocannabinoid system. So if you're only having one of those cannabinoids versus multiple cannabinoids that could hit your endocannabinoid system, you could see that that might not be as effective one way than if you had multiple cannabinoids. They work synergistically. So I want you to start to think about that as a new or curious person, because when you're in the market and you're starting to buy products, knowing what's a distillate product versus what's a whole plant product is just important to know. I'm going to leave it there right now. Side effects and tips. So the most common side effect is dry mouth. So be sure to drink plenty of water before, during, and after. Would suggest that, again, always start low and go slow with any kind of product. And then if you are a medical patient, do recommend that you become registered with a certified healthcare provider that can certify you as a medical cannabis patient, and then access the no tax and the discounts and the higher limits. I think it's important, and it does save you a bit of money. Next slide. All right, so the Cannabis Control Commission has a great website that you can go and access any information you might need for the adult use, recreational use, personal use, or medical cannabis use. So this is some of the sections just for the patients. Next slide. It's the Cannabis Control Commission of Massachusetts. So we are going to shift to some Q&A time now. After we get through the Q&A, we'll give you a little sneak peek of what our next event is. But I'm going to hand it back over to Vanessa and to Glorya. And I would also love to, if I have missed out on any information in this slides or anything was unclear, please now feel free to jump in. And here we go.
Well, if I want to go back to the beginning of the slides, can you talk a little bit more about the history, like what it was used for, like really, and even talk about America? There's a rumor about America having a patent. So can you talk a little bit about that?
Sure.
Please.
All right. And everybody, feel free to post in some questions online onto the chat forum, and also feel free to jump in. So cannabis and what it was used for, here's the history slide that everybody's got it up. It was for a variety of health conditions that it was listed in the US Pharmacopoeia 4. If you can give me a second, I'll find it in this book to get the exact list. But now how it works is that there's a variety of evidence around specific health conditions, including cancer, ALS. We can even look at the list of qualifying conditions in Massachusetts for healthcare, that slide. So cannabis is used for arthritis, for menstrual pain, for headaches, migraines,
seizures, insomnia, stimulate appetite.
But back in the day, I have friends who are Jamaican, and they said that, it was always around as a tea.
Yeah.
A lot of people even here, when they came to America, would have a plant because of the healing properties.
A lot of people use the whole entire plant,
Exactly.
root and all.
Exactly.
Back to the Entourage Effect and the whole plant medicine versus distillate.
100%.
What is
So the
distillate?
patent, yeah. So
Little
distillate
spectrum.
is an isolated cannabinoid. So it's distilled down.
Okay.
A
Okay.
distillate. And from the
usually done in
patent,
alcohol, right?
You can use different, methods.
Okay.
trying
You
to
can
pull up.
use CO2, you can use alcohol, you can use butane, ice.
Wow.
I just invested in a rosin press, which is like the absolute cleanest because it's just heat and pressure. You take your, like when I harvest, you freeze your bud, press it. There's nothing else. You're not adding anything into the bud. It's just pure concentrate.
We're also going to get some videos of this being done because caramel glows like a deer in headlights. I have no idea what this looks like, but
clean.
And
yeah.
Go ahead. Yeah.
so
So
I can,
go ahead, Desi.
Hi,
yeah,
Des.
so in terms, the question was about, can you just repeat the question one more time?
Yeah, she was asking really about the patent and the U.S. government. So I was just
Well,
about.
even the history, like what was it used? Like I mentioned about the Jamaican culture, but in other cultures, especially when I was doing my investigation, like it was used all over the world for different things. So just for people who just really want, like, okay, really prove it. This is a real doctor. This is a real doctor who can answer the questions. Like, what was it used for in the past?
Yeah, and it was used for those things like cancer and nausea and insomnia. And the U.S. government does have a patent, and we'll show. We'll put a link to it. I was trying to find it in here, but we'll put a link to the exact patent so that people can understand that and the history around that.
Yeah.
So it was used for a variety of those health conditions. Now, in the current state, where the evidence lies, because it was prohibited from researching in the last 50 years since it was removed from the pharmacopoeia, a lot of the funding has gone and the research has gone in Israel. So research, is happening. It's happening in Canada. It's happening in Israel. It's very soon. It's happening here. I've done some work here. Dr. Gruber's done work, and there's a publication called it's published by the National Academies of Medicine, Health, and Sciences, and it reviews the state of the evidence. So we'll drop a link to that in there too. And so for health conditions, where the research lies and where the research needs to go. And what they're finding is cancer, pain, and what I'm finding in my research studies also helps with things like insomnia, headaches, ALS.
Okay.
Yeah.
Thank you, ladies. We do have a question in the chat. The question is, what's the best way to counter the stigma around cannabis when suggesting consumption to someone who's never tried it before?
That's a good question. What do you think?
Can you repeat the question one more time? I'm sorry.
Most definitely. The question from the chat is, what's the best way to counter the stigma around cannabis when suggesting consumption to someone who's never tried it before?
Well, I'd like
Well,
to just
I think in my, I can help answer that. So in my experience, a lot of people who were really willing to try cannabis for pain, mostly were mostly convinced because they no longer wanted to take prescription drugs for it. A lot of people don't really like the way that the pills make them feel. And so in my experience, a lot of the people that come to me that are very curious about cannabis often need it for the top 3 reasons for me have been for pain, people who have trouble sleeping, people who suffer from anxiety, who have been taking medication for a very long time and sort of wish to try something else with less side effects. So I think that to summarize my answer for that is You know, when someone consumes cannabis for the first time and realizes that they can take the pain away without having to take pills, you know, that's definitely one step in the right direction towards breaking the stigma against cannabis, because they're now using it medicinally as opposed to the stigma of a ton of people just, you know, smoking it and doing it recreationally.
Cool. Yeah, I think some of that's a really good question. So I have recently, you know, hung out with a lot of my mom's friends and older women. And, you know, it comes up a lot because I'm trying to break stigma. And I think one of the things that I do is try to say there is science out there and there is data out there. So there is research that demonstrates, you know, efficacy. And then I also, you know, try and say that nothing ever has to be psychoactive. Some people are concerned about psychoactivity and, you know, not everybody. And so I'm kind of saying, if you start low and you don't have to be psychoactive and there's other options, that's been helpful.
You know what? I see the stigma also with my kids, my younger children, 11 and 14 years old, because I do treat a lot of elderly people. So when I bring my kids along for deliveries, we'll go to the old folks' home. They got the walkers, and my 11-year-old, she's definitely more into. She has that healing vibe, you know, and she's like, "Oh, we delivering meds today, Mom." You know, where the older one that's in high school still is like, "Don't talk about it in front of my friends."
It's so interesting. And I think this
like
is
a little
really
embarrassment
important
type thing.
Yeah.
You know, and I've been 100% open. You know, I've been doing this before they were born. You know, they grew up in my garden.
Yeah.
And my little one's like, "I got my safety scissors."
Yeah.
And the other one's like, "Oh, my friends are coming over," you know.
Yeah. I think it's really important.
If I can make a real tangible suggestion. Desiree asked me to watch a movie on Netflix called Weed the People, WEED, the People. And it covers everything we're talking about here. It even talks about the research in Israel. I think sometimes when we hear about, this science, we still have people who have made a choice not to be vaccinated. So science for some folks is not the end all be all. But when you see a child's situation in life changed, wow, that speaks to the power of the plant.
Mm-hmm.
It speaks to the power of the plant, folks. Cancer? Come on now. Like, it's like the superhero plant, and that's really the inflammation, the way it helps with that. We're talking about people having just amazing responses and who have PTSD. So if you need to find the science to back it up for them, but you show them that movie, and if they don't tear up, you need to pinch them and see if they're alive.
That is a really good movie, actually.
Yes.
I attended the screening, and I think this is a very important question, and we've hit it from multiple angles. There's stigma from all ages, all different, you know, neighborhoods, and I think it's really important. That movie is a great way, and continuing to educate and providing those kinds of resources are a great way to break the stigma.
Excellent, ladies, and great feedback. We do have another question in the chat from Pedro. What cannabinoids can I consume and not feel anxious?
Hi, Pedro. I saw that in the chat. That's why I'm opening up this book here. That's a great question. Do you
want to stay away from?
I can start off answering. My response to that question would be normally CBD CBD that is more calming would be better for people who experience anxiety. There are different strains in marijuana or cannabis, and some of those strains do help with anxiety, and some of them, you know, don't work well with certain people.
Exactly. So anxiety is a really, really tough condition for many reasons, because you don't want to take something that's going to make you energized, or, you know, obviously if you're in an anxiety situation or anxiety prone. And so it's a very, very, but anxiety is the top reason that people are consuming cannabis in our studies and finding medical relief from it. And it's specifically important right now because of COVID. And we have a real increase in anxiety, PTSD, and depression. So to complement what Desi was saying, and what I'll do is I'll put we can put a specific anxiety links in here too. But CBD, I was even saying, and please jump in here, has mainly significantly reduced anxiety and plays a role on that. If you have higher THC strains, then they might be not great if you're in a panicky situation. And I really want to talk about an indica versus sativa, because there's a really interesting discussion going on in the field about not calling it indicas and sativas and calling them chemo bars, because everything's a hybrid. And so stricken, like going with what's the science?
What's the name again?
Chemo bar.
Chemo.
Are you hearing that too?
Yeah, I think I sent you a slide about that.
Yeah, what do you think about it?
I'm not sure.
You're not sure?
I'm not sure.
Yeah.
I think there's still, I see the way my plants grow, and I can look at one and distinctly know if it's a sativa or an indica.
Interesting.
So I don't under.
Is it CHEMO in the beginning?
Yeah.
And
chemo
also,
bar. Uh-huh.
I have patients with anxiety, and if they medicate with something that is more high in the sativa side, that induces more paranoia and panic, and they'll text me like, whoa, nope, because I have everyone keep a little log. Does this work good? How do you feel? Next week, let's try this. Yeah. And I say, put it in the cross off. And it also depends on the way you consume it.
And I'll explain a little bit to people who kind of don't know much. So from the THC, there's normally like 2 different type of plants, but like Marion said, most of it is a hybrid, so it's very mixed. But when you go to a dispensary, per se, you have the option of purchasing flower that is sativa, which gives you energy. And then you can also purchase flower that is more indica, which is really good for pain relief and for sleeping. And so depending on whether you have anxiety or you need to go to sleep, then you want to make sure that you're choosing the flower that gives you the effect that you're looking for. So sativa is known to be the upper and the plant, the strain that gives you more energy, and then indica is the one that you would use if, like Pedro said on the chat earlier, for surgery. So, if you've just undergone surgery, you're in a lot of pain, you definitely want to consume some of the indica to help relieve your pain and help you sleep through the night.
Thank you, Desiree. This is actually a great time to actually discuss why we need THC and CBD together, or at least why it's important to have them together.
Yeah, and that's a good point. I mean, that's back to the entourage effect and whole plant medicine. And I think the other interesting thing that I want to pop in here now is, we are talking about these anxieties and conditions. When people are consuming cannabis, at least in our studies, they are not doing this in isolation. And you expressed that earlier. A lot of people are using cannabis to either reduce anti-anxiety meds, benzodiazepines, or any other anti-anxiety pill. Mm-hmm. And so that's what we find in our study. We're going to talk a lot more about that in our next event.
What do you mean by not in isolation?
Meaning when a patient comes to me, I'm going to ask them what meds they're on. Because the medication they're on is going to affect the effects of the plant medicine.
So it's not isolation, meaning it's not the single medication that they use.
Yeah. So I mean, maybe they all, and this is extremely important.
You will see why I am here to ask the basics.
It's an extremely important thing because why? Because when you're on a cocktail of medications, say you're on chronic pain or you have 5 or 6 different medication types that you're taking, you really do need to understand how that does interact with cannabis. There's some interactions that are not good. That's probably a little too technical to get into for this event.
I understand.
But I am doing another event in 2 weeks that we will get into those technicalities if folks are interested with Wayne State University.
Your diagnosis, why you're using it is so important.
Why you're using it, what meds you're using, and then if you're actively reducing those meds, how do you titrate and dose your cannabis and in what form? And then alerting your healthcare provider that you're doing this, even if they're not trained, is extremely important.
It's documentation.
And awareness raising for them.
Yeah.
I mean, if I was a doctor, I would want to know what types of my patient that I've prescribed benzodiazepines, they're trying to get off of that. I mean, I would want to know.
And what is it usually for?
Sorry?
What is that?
A benzo?
Yeah.
Anxiety or pain.
Okay.
And this is just one of many different types of medications. I'm not trying to,
Benzos.
yeah, but I'm not trying to call out the benzo, but it's just one of many, you know what I mean?
Yeah.
Even
So,
blood thinners. Remember I was saying CBD?
Right, when I
Can
told you
interact
about
with a blood thinner.
when I
So
was
if you're
doing
on
something-
heparin or Coumadin, and I mean, you don't see that when you go in CVS or you're at the drugstore.
What effect does it, what do we have?
It also, it thins your blood more. So
it's
you end up
important.
getting, you know, if you're getting bruises or you get a cut that's not stopping.
So these are all bringing up
These are
really
little-
important points that I think I want to make sure that we provide resources for people that are listening now. So because we're not able to cover all the drug interactions that exist, but it's super important when you're starting and curious to know.
Just to talk to someone that kind of knows what they're
Yeah.
talking
Yeah.
about.
Makes
And
sense.
that's actually a really good segue, ladies, for obtaining a cannabis card. Where exactly would people go, and can they just go to their primary doctor or a doctor just to become a cannabis patient?
I'm going to use this as an opportunity to advocate.
Even your dentist?
Even your dentist. So what you can do, there's a list of
Let me pull that up.
certified,
That went fast.
yeah, well, I'll talk about it in just a second. There's a list of certified registered medical cannabis clinics that you can go to. How we can make it.
Not all physicians are certified to give you the prescription to
Correct.
get your card.
So most of the normal mainstream medical system still doesn't have medical cannabis integrated in their education. And some of them are not allowed to become a registered patient. They fear their health system, or they're not. So your regular doctor most likely isn't a cannabis approved certifying clinician that you're going to in a formal health system. There are these outside clinics that are medical cannabis clinics that are certification clinics where you can go in and you can tell them you get a clinical exam, and then you tell them your diagnosis and you get a card. Then you have to register into the state system and you get a state medical cannabis card. I can pull mine out and show you. And then this card allows you to go into a medical cannabis dispensary. Anybody can, if you're above 21 and have an ID, you can get into an adult use or recreational dispensary. But you can get a medical patient card that you then, with your ID, go and access a medical dispensary. And the medical side is they provide more counseling. They provide, you have, curbside pickup. You can do telehealth appointments to get your card. MedWell is a common one. Alternative wellness centers is a common one. There's a couple of places out there.
You avoid the 20% sales tax.
Yeah.
Big, big, big.
Yeah. So back to the points. When you get as a registered cannabis card, what I presented earlier, just what Erin said, you don't get taxed. You get discounts to order your cannabis and you get larger limits.
So how long does it take for the process usually?
So, that's funny because we'll have to figure out on the exact dates.
Yeah.
You can go in and get a card.
I think it takes about a month or so.
Sorry, I think you can go in and get a card, get certified immediately, and the doctor can register you in the state system and you can go and buy cannabis that day. The physical card will come later.
Okay.
The fee is when you're going in to get a doctor certified, but there's no fee to register with the state anymore.
Okay. So you would have to pay your practitioner.
So
extra.
You have to pay, I think it's roughly around $100 to put the application through. And so
Yes.
if anyone here today is interested in obtaining a medical card, please put your email on the chat, and we can get you information on how to go about that. And there'll be links also on Dr. Marion's Canna Center for Excellence and her Cannabis website. Are the links on the chat, Doctor?
Yeah, we can, and I think the best place to go is the Cannabis Control Commission website. They have a list of all the different providers, so we'll put a link in there, and we'll have a resource document that comes out of this for sure with all these
And I'll
really
just add
interesting.
on to that. So the difference between when you go into a medical dispensary, you do need a medical card. When you go into a recreational dispensary, you need to be 21 plus and have a regular ID. You don't need the medical card. What a lot of dispensaries are doing now is that they are going for their also medical cannabis license. So you will, I think you will be seeing more dispensaries that are both recreational and medical, which is great for communities because it offers them options as far as how people can consume, can get their cannabis and the reasons for it.
And so I actually do have a question in the chat. What's the big difference between medical and recreational cannabis and dispensaries?
So it's really,
That's what yeah. Okay.
so it's really around, so like what I said, the difference is when you think about it recreationally, not what you're buying, okay? When you think about it, because honestly, the way that the industry is right now, you can buy similar products on the adult use side and you can buy it on the medical side. But if you're a medical patient, you can go in and you can get higher limits of what you can purchase. And, you know, a different mix of things, but I haven't seen that much here yet.
Higher
The
limits
mix,
mean higher THC.
higher purchase limits for
Oh,
milligrams
okay.
quantity,
Quantity,
because
okay.
patients often need more than a
Gotcha.
recreational consumer. So when
And a
you're,
patient can have a caregiver, so if a patient can't get out the house, you can appoint someone to go purchase for them and bring to them,
Gotcha.
transport.
yeah.
Gotcha.
You
Yeah.
know?
So, or home cultivate on a patient's behalf. That's legal here in Massachusetts.
Okay.
And there's a movement I was just at the advisory board meeting, they were talking about, you know, thinking about institutional caregivers. And that's, I think, really important. Yeah, like, so, you know, and the adult use side, you just need an ID to get in and you can get these products. But like I said, on the medical side, you're going to get extra counseling. You'll also get, you know, extra discounts and higher purchase limits.
And also the dispensaries in the Commonwealth, I think they need to keep an extra supply for medical patients.
Yes, they do.
Right?
The patient safety
Yeah.
net. So, yeah, and that's a good thing. But there are definitely less medical dispensaries than there are adult use.
I got a question. There's sometimes a little bit of a underbelly conversation that there is other drugs mixed in with the medical marijuana. Any truth to that?
So that's not, I mean, if you're buying cannabis at a regulated licensed dispensary, that's not happening. What that would happen is potentially on the unregulated market or on the legacy market. And that is really bad and sad for the industry and why regulation and
What's the
testing is
legacy?
a legacy market. The cannabis has been sold on the market for ever, and now it's regulated. And there's in the regulated and the tested industry, they are testing for things like that. So you can be assured when you go into a medical dispensary that it's tested and that it's safe and you know what the product is. There's a label. But there is a legacy market. There's a leftover market of underground that has the potential to have something like that happen.
Black market.
Okay.
Street market.
Street market.
Okay.
Yeah. And
Where it's not tested, you don't specifically know what you're buying, what strain it is, where it came from, when it was harvested,
and,
what nutrients they used or did not use, or pesticides that it was sprayed with or not sprayed with.
Correct. So it's always best if you're a new consumer to make sure that you go to a medical cannabis or a regulated dispensary to make sure that you know that it's a safe product and you know what's in there and it's tested and labeled. To your point, I think what's really scary out there, and I want to hear from others and kind of not take a tangent and obviously ask more questions, is the fact that we do have a lot of harder drugs out there than cannabis, and cannabis is non-lethal, but there's this stigma that we've been talking about. And I think we really need to break awareness and the fact that we are in an opioid crisis that is out of control, in my opinion, from a public health perspective, with all sorts of lace street drugs and all sorts of things. So what would be good as a new way to encourage people is to understand that cannabis is non-lethal. It can be a medication alternative for some of these addictive, other addictions. Erin's seen it, you've seen it, I've seen it in the data. People are using cannabis to reduce to detox, to reduce unwanted side effects or unwanted meds.
Yeah.
Again, knowing how to do that safely and using tested cannabis is really important. And we can provide some of those links around that. But so from the perspective of, can cannabis be a tool in the public health toolkit for the opioid epidemic? Absolutely. That's what I talk about every single day. So,
and really to, speak to how we've all seen it. I worked on Albany Street, folks. I also used to go to school on top of a methadone clinic. Boston Healthcare for the Homeless program. You can't get more deep than that. And when you're willing, as a society, to allow folks to come in and shoot up, why not have an alternative for them at the same time? Folks just, for a person to want to be in that place where they're shooting up, there's some kind of intense pain that they're trying to numb. Maybe just a really nice joint and some edibles, some counseling,
That's great feedback, ladies. I do have a very good wrap-up question, and that would be, what would be your guys' preferred way to consume?
awesome. So this is our last question. And what would be our preferred way to consume cannabis?
I'll go first. I would say, and I'm going to speak from the experience of the people that I know that consume. I will speak with the experience of the people that I have guided through consuming cannabis through edibles or lotions. But a lot of my aunts, uncles, and a lot of people who are, over the age of 50, they don't want to consume cannabis. They don't want to smoke cannabis and consume it that way. And so a lot of their preference lies a lot around either tinctures or salves that they can put on their skin and help with the pain without having to feel the psychoactive effects. But a lot of the people who do take the edibles, they just start at very small microdose levels, and then they work their way up to a level where that relieves their pain. So in my experience working with other people, I've seen a lot of people want to take edibles or put on some cannabis lotion to help with their pain.
Well, just didn't answer the question. The question was you.
Right. What's your favorite method? Des, what's your favorite method?
I like honestly doing both. I don't get a lot of pain, so for me, I try to use. I'm always using a roller, like an oil roller. I used it before the meeting. It's mixed with other smells like peppermint and lavender. But when I rub a little bit of the lotion, the oil on my neck, it definitely helps relieve some tension. And so I really enjoy having the oil roll on that I can put on my skin and help with any aches and pains that I may have whenever I do have them.
Cool. Awesome. I like the roller. Maybe I should get one of those.
Essential oils.
Yeah. What's your favorite?
It's gonna age me. I like smoking a blunt.
That's like contemporary.
Blue Dutch, old school.
Oh, Lord of
blunt.
mercy. Where do
There
you
you
find
go.
those? Order them online from 1987?
I know, half of them stale.
What about you?
I plead the fifth. I'm
Yeah.
a born again virgin.
Yeah.
You don't discriminate.
I
You
don't-
like everything equally.
You know, I have a back issue. I have a pinched nerve, and for me, the inhalation works because I get up and I exercise. I've dropped 50 pounds this year.
Wow.
You know, because it numbs. I was having lapses where my leg would kind of give out, go numb because of the pressure in the back. And listen, 292 only looks good if you're 6'7" and playing in the NFL, making $15 million. It's not cute when you're a woman of a particular age living in a hoodsie. You know what I'm saying? So we had to let that go. The edibles I'm getting used to, even though I would make them for people, the way I would do them to microdose. So because I was making vegan, I was making sweets, you know, like ginger muffins and stuff. I wanted them to be able to eat 2 or 3. And if they really want to knock themselves out, they could have 4 or 5, but enjoy it as it's going down. Yeah. Only thing I've never tried is a tincture, and that's under the tongue. Is that correct?
Yeah, the sublingual.
How long does that usually take to touch your body? And that's a body high, right?
That was quicker. That was a quicker
Fast-acting.
onset. It's a fast-acting
It
onset.
depends on what type of tincture you're using.
Oh, so you can get a sativa that will give you a.
And
yeah,
Oh,
yeah.
It
Use
all
anything.
depends
It's just
on the plant. You can take that plant, you can make anything out of it. You can take that plant and make it into a topical, a tincture, an edible.
okay.
You
yeah.
roll it up into a joint, but you got to pick the right plant for you.
Yeah.
That's where people need help, because they're picking the wrong plant for what they need it for.
Exactly. Back to the point about anxiety. And
Wade,
yeah.
what's your favorite way? Dawn?
Yeah, my favorite way now these days is actually drinks and ingesting it, but not for it take a little bit longer. You know, I like, you know, and the drinks are interesting. I really like drinks. I also really like smoking. I like, you know, smoking a good solid joint. I was trying to I like extracts, but I think personally for me, it's difficult. And we'll talk about that in the next episode, because I know but it's a little bit difficult on the extract side. I still feel like I'm learning and about how to consume it. It's really strong.
Yeah.
You know, kind of the torch and everything, I can't really jive with yet. So I feel like there's more innovations in that side that we'll be seeing coming out. And there's great devices that are out there that help you do it. But yeah, that's me. I like flower. I like smoking a joint. Yeah.
Yeah.
All right. I want to, Marion, I want to take this opportunity for you to share a little bit about information about our next class and your research data. If no one else has questions.
Yeah. Awesome. So
We have one more question in the chat. It just popped up for you guys. And that is, can cannabis help with weight loss?
yes. Yes.
For me,
Yes.
for real, because
It has that stigma. Stoners get fat because they're munching. Not true. Not true.
Listen, my bathroom is clean.
Depends on the
Because
depends
the
on what
sativas.
plant. Depends on the plant.
Yes. It would help me to ease up the pain in my back. I would get out and walk and exercise. I was a wake-in baker, and people were asking me, you know, someone asked me if I had weight loss surgery because it was coming off so quick, but I was able to just push past. And that's what the blessing was for me. Just push past the pain. It's scary when you can't feel your toes, friends. It's very scary.
So Glorya, what I'm hearing from you is that it helped you because it took the pain away and you were able to exercise and sort of do your weight loss practices.
Yes, and you know, the way I was, this is a whole process, because again, I was 292, so it was still something a process I had to work with in terms of my eating. So for me, I was using trim. When I was smoking bud, I would have the munchies. If I smoked trim, I didn't have the munchies. So that's how life was for me, and that's what worked for me.
Which every patient's different.
Right, right.
Yeah.
But I can, I had some bud that some people shared recently. And again, my bathroom is spotless from top to bottom.
It's so funny that you say about the cleaning because, there is this one strain at one dispensary in Massachusetts. And I go there often, and every time, like, this strain is really good and I really like it. And it's an energizing strain. And they always say everybody that does it cleans their house. They love this thing. They clean their house, get active, move around. So there's that way. I think there's a lot of benefits from, how cannabis can contribute with weight loss. And there's a lot of, interesting things around cannabis sports medicine and like performance and, and that kind of approach. So getting the other benefits of it could also be, because some people are consuming for anxiety and depression, that's relieving it, then that's getting people out
Off
and
the
back
couch.
off the couch again.
Well, because I know that was part of my issue also, when you realize that you're the weight that you are, and you are not able, you're starting to have illness, it exasperates the back. I was paying for a chiropractor. He was like, "You really just need to lose weight. Let's start there."
Yeah.
It's
worked. You've lost a lot of weight. That's amazing. Yeah. That's amazing. All right. Well, so sneak preview. Oh, go ahead, Desi.
I said that's awesome. So I think we have one more question.
Oh, cool.
Can cannabis help kids with autism? And if so, how can you convince a parent?
Yes.
I know, and I'll let Erin answer this most if she'd like, but I know that there are CBD strains that are known to help with autism, not take autism away, but to help relieve some of the symptoms that kids with autism experience. Erin, what's your experience with children with autism and CBD?
I've seen full spectrum with kids with autism prescribed by a doctor and monitored closely. But I've seen good results in their behaviors and their attitudes, emotional.
Mm-hmm.
But anything with kids or pediatric definitely needs to be closely monitored.
Yeah. So, and the difficulty of pediatric, so yes, to complement, also autism is a huge area where it can have a real good impact. People, kids that are nonverbal becoming verbal, like all sorts of really miraculous things happening around autism and cannabis. In Massachusetts, you can have a pediatric cannabis card. You need to have 2 providers recommend the pediatric patient though. So this is a really big barrier, something I advocate on regularly because it is very difficult, but I know this movement to kind of get more pediatricians involved. But to the question around how do you convince a parent? I would say there's that are out there, and there's some practical realities of this being implemented. Autism is on part of the medical list of state systems. So the easiest way to kind of get people to, hey, it's a state approved thing. I don't think the state would do it if it wasn't evidence-based.
A child,
and it's a child.
It's a child. That's where parents get nervous,
Oh, absolutely.
Well, they say
experience thing.
Yeah.
Remember the one with the baby in the movie where the baby had some kind of inoperable cancer? Or no, the baby did have operable cancer, but she had some, remember? And
Is this Weed the People?
Yeah.
Weed the People.
Yeah, so this is all about pediatrics. So
Yeah.
yeah, for that question, check out Weed the People too. That might be a good way to get somebody to convince the parent by watching a movie.
Yeah.
Another way could be pointing them to evidence that, it exists in other places.
And they can find out more evidence based on watching the movie. I mean, they're really curious about it. Spark it.
What about parents? What's that website? Parents in Time. Parents out of time.
Patients out of time. Patients out of time. Yeah, Patients at a Time is actually a conference that we're going to be presenting this research study at. So if you are, I'm gonna just give a quick 2 plugs here. One, if you are a healthcare provider, this is a research study that, please scan this. Oops, let me get it into the video. There you go.
Take a picture.
Yeah, take a picture or scan. So this is a research study that I'm running right now as the principal investigator, together with UMass Dartmouth and Medicinal Genomics, and Patients at a Time is one of the investigators. Patients at a Time and the other groups that we're working on are clinical educators that run conferences every year. And they're really great because Patients at a Time is straight up OG, really old school, awesome researchers, clinicians, Meshulam, people that work in this grind for a real long time. And they're clinical and they're research and they know what they're talking about. So I definitely
And they
recommend.
based also the research.
Yes,
Yeah,
the
I like when they
cannabis.
advocate for kids.
Okay.
a lot.
Yeah, and they do a lot of, yeah, they're,
Grassroots advocates.
yeah, and they're clinically and scientifically rigorous too.
Mhm.
But so for the next event on November 17, what we're going to talk about is really the research and some of the nittier grittier. We've talked about, what are some of these conditions. Let's look at the data in more depth. And what we've been finding, next slide. Thank you again to High Profile Bodega, our series sponsor here. Well, when we touched on this a little bit tonight is that the COVID-19 pandemic and our opioid epidemic here in Massachusetts is really out of control. And the drug deaths are on the rise, and they're on the rise in all communities, but specifically in communities of color and communities of color here locally. And we've talked a lot today about cannabis as a non-lethal alternative substance that we could be advocating and working towards. So next slide. I've personally seen in the research studies that I've been the principal investigator of for the last 5 years, between 50 and 76% of the thousands of people that are reported in our studies are using cannabis to reduce unwanted prescription meds or opiates. So this is something that is a public health emergency, and we really need to get the word out to help people. So our next event, we're going to talk a lot about different strategies, all the dosing stuff, and different ways that we can start to really unpack how this can work. I think this is an important point and statistic, because these are people that we're working with. These are people that were coming into the retail facilities and the medical. These are our friends. This is our family.
I was gonna say there are coworkers.
Our people, our coworkers, our friends, our family members. This is it's a real problem. So we would like to be part of the solution around that problem. And so next event, we'll be covering more about how we can really dig in from multiple perspectives. And next slide. Our last event will be an in-person networking event, and that will happen in Boston. We're planning to have some pretty cool demos and things, engagement ways, and just real informal open house networking type. I know that the boring presentations get to be a little boring, but hopefully they're helpful later. You can reference them later. So yeah, so we
to come and be in a safe space.
Yeah, just come be in a safe space, come and ask questions.
Also come and apply for a dispensary if you're interested in working at a dispensary. We High Profile Bodega will be opening up 3 dispensaries in Rosendale, Dudley Street in Roxbury, and Freeport Street in Dorchester. Anyone interested in working in the industry, please come by, scan that QR code, register. We're gonna have light music. This is really an opportunity for people to get to know each other, apply to one of the 3 of the stores, and even ask more questions. So thank you all that came out tonight. I really do appreciate you being here. We worked really hard to bring you this information, so I hope that you enjoyed it. Please also feel free to give feedback, or if there's any other topics that you want to dive deeper into, please put it on the chat. And next year's series, we'll be sure to take all your feedback into consideration and offer more education around what you guys want to learn, not what we want to teach you. So again, thank you all. for being here.
Yes, thank
Ladies,
you all.
would you like to say goodbye? And yeah, okay.
Yeah, thank you for keeping us organized, and thank you, Vanessa, for being our virtual amazing guru. We appreciate you so much. And again, thank you for joining us tonight. We'll have this video up on our website, and we're excited about the next one. So thank you all for coming.
Have a good night, everyone. Bye-bye.
Bye.
Thank you.
Thanks, Pedro. Thanks for coming and for the questions.
Absolutely.
Yeah, you're the best.
How's everything going?
Doing good. I got to reply to your email, which I will do.
It's all right. Take your time. Take your time. I'm over here fluttered and flustered with everything going on with the shop and stuff. QCC's coming in tomorrow to interview my wife and I and with the plant shop and stuff like that.